Hello, welcome. This is Christian Meyer. I'm an associate editor for JACC, and I say hello from Düsseldorf in Germany. And I'm quite happy that David Schaack today here from the CCB team in Frankfurt is with me. Congratulations for a quite nice paper. Thank you for publishing with us with JACC. And yeah, I'm looking forward to the OLIVE strategy. Quite term as we know it from you and your group. So please, David, tell me. The title was OLIVE Strategy, Improve Pulmonary Vein Isolation Durability with the pentaspline pulse field catheter. Please tell me, what were your major insights from the study and what have you done?
Yeah, thank you very much for the introduction and the opportunity to present our research. So we know that the pentaspline pulsed field ablation catheter has been around for some time now, and it's gained a lot of popularity for pulmonary vein isolation. It is fast and quite safe. I think we can say that from all the data we know yet, but we also know from some registries, from some smaller studies, that the pulmonary vein isolation durability in remapping procedures was not really superior to the conventional thermal ablation. And so what we sought out to do is we wanted to improve the durability through a new ablation strategy, which adds what we call Frankfurt OLIVE configuration to the typical 8 applications per PV. We do 2 applications in this smaller OLIVE configuration, so we have 10 applications per PV. And what the main findings from the study are, we assessed 400 patients which were treated with this OLIVE strategy between June 2023 and July 2024. The procedure time and the fluoroscopy time are not prolonged compared to the conventional strategy, which we expected because they are very short applications, 2.5 seconds per application. It is a safe strategy. We had an overall complication rate of 2.75%, mainly driven by vascular injuries. There was no case of acute kidney injury, which is important because we increase number of applications, potentially hemolysis inducing, and there was no PV stenosis in the remapping procedures. And our main finding, the important finding, comes from redo procedures. We were able to compare 22 redos after PVI with the OLIVE strategy to 80 redos after the conventional 8 application strategy. And we found when looking at patients with PV reconnection, with at least one PV reconnected, that only 13.6% of patients after OLIVE strategy had at least one reconnected PV compared to 45% after the conventional strategy. And when we assessed this on a single pulmonary vein level, we compared 87 to 317 treated PVs, and only 4.6% of these 87 PVs after OLIVE strategy were reconnected compared to 20.2% after the conventional strategy. So I think we can quite safely say that we improved the PVI durability. The also important finding, which we should not leave out, is that the freedom of arrhythmia, at least at 180 days after ablation, did not improve between the 2 groups.
Yeah. Thank you so much. Quite nice findings. Okay, for everyone who maybe is considering this approach, any tips and tricks, any special things to consider for the procedure, or what are your recommendations on this?
Yeah, definitely. So the way we use the OLIVE strategy is we always go into the OLIVE from the basket configuration, and we put some pressure on the catheter. So what happens is we put pressure on the catheter towards the PV ostium, and then we make the configuration smaller with the sliding handle, and we observe how the OLIVE really slides into the PV. I think this is the important tip to see, that it slightly protrudes into the pulmonary vein. We added 2 videos to the paper as a supplementary material. And I suggest for everyone who wants to adapt the strategy to look at the videos to really see what I'm talking about when I say slide into the PV. I think the other important tip is to remember how many applications you're doing. If you're doing only PVI, which we usually do, then these 2 applications per PV should not impact hemolysis and acute kidney injury. If you're doing a lot of extra PV ablations, remember that you're adding applications with the OLIVE strategy.
Perfect. Congratulations once more to you, to Bo Schmidt, Yonggi Chun, and the whole group. After this brief introduction of the whole approach, which is quite nice, what do you think as well? Are there any drawbacks, challenges, pitfalls? What are the next steps to consider?
Yes, I think one major limitation of the whole strategy is that the naming conventions for the different configurations of this catheter are not really defined. So what we call an olive may be something that other operators already do and call a basket configuration. I think this is very important. That's once again where I suggest to look at the videos, look at our pictures, because if you're already doing very small baskets, which probably already protrude into the PV, then you may not add benefit by doing these additional applications in even smaller configuration. This is the main limitation. And what I really hope as an outlook is, I know that some other centers already adapted this strategy some time ago, and I hope that we will see remapping data from other centers to see if this is reproducible, and from other operators to see if they also improve PVI durability. And the other limitation, or the other curious finding, is that we did not improve freedom of arrhythmia. So this is right now quite a limited analysis. The freedom of arrhythmia was only assessed for 180 days because we do not have longer follow-up times for all the olive patients, and there was only 100 olive versus 100 conventional patients for this specific sub-analysis. So I think I'm looking forward to having more data, longer term follow-up, and more patients to compare. And then this, of course, raises the question, which percentage of freedom of arrhythmia can we even improve by improving PVI durability? Yeah, this is an interesting question.
Yeah, absolutely. So we keep looking what to do beyond PVI. Nevertheless, thank you so much. Congratulations once more. And yeah, looking forward to your next steps. All the best for now. Thank you very much.
Thank you very much for the opportunity. We're happy to present the data, and looking forward to more research on this.